This foot cream is used to relieve minor muscle and joint pain, such as arthritis, backache, and sprains. The active ingredient, capsaicin, works by reducing a natural substance in the body that transmits pain signals to the brain. Apply a thin layer of the cream to the affected area up to 4 times a day, or as directed by your doctor. It is best to use this cream at the same time each day for the best results. This medication is meant to be used only on the skin. Make sure to follow all the directions on the product package. If you have any questions, ask your doctor or pharmacist for guidance. For the cream, gel, and lotion forms, apply a thin layer of medication to the affected area and gently rub it in thoroughly. It's best to use a cotton ball/swab or latex glove to apply the medication to avoid touching it with your hands. Avoid applying the medication to the eyes, mouth, nostrils, or genitals. If you do accidentally get the medication in those areas, flush with plenty of water. Also, do not apply this medication to skin that is injured or irritated, like cuts, scrapes, or sunburns. Try not to apply this medication immediately before or after activities like bathing, swimming, sunbathing, or heavy exercise. Also, avoid bandaging or wrapping the affected area or using a heating pad on that area, as it may increase the risk of side effects. After applying the medication, remember to wash your hands unless you are using this medication to treat your hands. If treating the hands, wait at least 30 minutes after applying the medication to wash your hands. Consistency is key with this medication, so make sure to use it regularly at the same times each day to get the most benefit from it. Keep in mind that this medication may take up to 2 months to work. If your condition lasts for more than 7 days, gets worse, or keeps returning, make sure to inform your doctor. And if you suspect a serious medical problem, seek medical help right away. You may experience warmth, stinging, or burning at the application site, and if these effects persist or worsen, contact your doctor or pharmacist. Be cautious to avoid inhaling the dried residue from the medication, as it may cause coughing, sneezing, watery eyes, or throat irritation. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential side effects. Most people using this medication do not experience serious side effects. However, stop using the cream and notify your doctor immediately if you develop blistering or swelling at the application site, or if you experience increased or unusual pain. While a severe allergic reaction to this drug is rare, seek medical help right away if you notice symptoms such as rash, itching, swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, contact your doctor or pharmacist for advice. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. Before using Zostrix HP Foot Cream, it's important to let your doctor or pharmacist know if you have any allergies to capsaicin, zocapsaicin, hot peppers, lidocaine, or any other local anesthetics. Some inactive ingredients in the cream may also cause allergic reactions, so it's best to talk to your pharmacist for more details. If you have any health problems or are scheduled for surgery, it's crucial to consult your doctor or pharmacist before using this medication. Additionally, if you are using the patch and are going to have an MRI test, it's important to inform the testing personnel as some patches may contain metals that can cause serious burns during the MRI. For pregnant women, Zostrix HP Foot Cream should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. Furthermore, it's unknown if this medication passes into breast milk, so it's best to consult your doctor before breastfeeding. When using Zostrix HP Foot Cream, it's important to be aware of any potential drug interactions. Certain medications may change how Zostrix HP Foot Cream works or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's also important to note that capsaicin, the active ingredient in Zostrix HP Foot Cream, is very similar to zocapsaicin. Therefore, it's recommended not to use medications containing capsaicin while using capsaicin. Always consult with your healthcare provider for personalized advice and recommendations. If you or someone else has swallowed this foot cream and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222. For Canadian residents, contact a provincial poison control center. It's crucial to act quickly in case of an overdose. Make sure to keep all of your medical and lab appointments to ensure that the Zostrix HP foot cream is working effectively for you. This will also help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to use the Zostrix HP foot cream at the scheduled time, use it as soon as you remember. If it's close to the time for your next dose, then skip the missed dose and continue with your regular schedule. Do not apply double the amount to make up for the missed dose. Be sure to check the storage information provided on the package of Zostrix HP foot cream. If you have any concerns about storage, don't hesitate to ask your pharmacist for guidance. Remember to keep all medications out of reach of children and pets. It is important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. When the product is expired or no longer needed, it should be properly discarded. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.